Hey everybody, what's up? Dr. Nick here with another public sexual announcement for you on April the 12th, 2022, and I hope you are all having a great day out there. And as many of you already know, I like to educate others as I educate myself. So today I want to talk to you about something I never heard of before. And I'm sure you've heard of people who engage in sleepwalking and sleep talking and in some cases even sleep eating. Well, what about people who engage in sexual activities while they are 100% completely asleep? The term sexsomnia was officially coined way back in 2003. One of the earliest cases appeared back in 1986 when a young Singapore man reported that he was masturbating during his sleep almost every night. And then, in the Journal of Clinical Sleep Medicine, they described a case of a 37-year-old man whose wife told doctors that they had been having sex while he was fast asleep for most nights for 13 years straight. And the man did not believe what his wife was saying, and he had no recollection of his sleep activities until she showed him a video. And at the same time, while most cases of sexsomnia appear in men, there are some cases that actually do appear in women, where one recent case involved a 42-year-old woman whose husband asked her to seek help because she was frequently fondling him, masturbating, and saying other people's names while she was completely 100% knocked out asleep. So at this point, you can probably guess that sexsomnia means sexual behavior while you are asleep. And some of these sexual activities can include masturbation, spontaneous orgasms, sexual vocalizations, fondling of a bed partner, oral sex on a bed partner, and vaginal or anal sex. Now here's where things get kind of interesting. An episode of sexsomnia will last around 30 minutes or less, and the patient's partner will describe them as being more direct, more aggressive, less inhibited, less focused on the partner, and they will sometimes engage in sexual activity that they will typically not do when they are wide awake. So one of the burning questions that you may have right now is what causes sexsomnia? Well, sexsomnia is typically related to issues such as sleep deprivation or irregular sleep patterns, alcohol or drug use, increased stress or anxiety, medication use, and fatigue. Other issues that can be related to sexsomnia are obstructive sleep apnea, gastroesophageal reflux disease, migraines, sleep-related epilepsy, and narcolepsy. Next question is, how do you treat and stop sexsomnia? Well, according to Dr. Daniel Block, who is a clinical psychologist in Pennsylvania in the United States, he says this: an individual should engage in sleep hygiene measures, manage stress, optimize the sleep environment, and avoid known triggers for parasomnias like alcohol, drugs, and shift work. He also says this: if a person's sexual acts are unwanted or pose a risk of violence, the person should make efforts to reduce the risk of harm to others. For example, by sleeping in a separate bed or a different room, or installing a lock on the bedroom door that cannot be opened during sleep. So in closing, I just want to say that I hope you learned something new today, because I damn sure did. And at the same time, I can easily see how people don't believe that this parasomnia is real. But then on the flip side, I've also heard stories about people who will find their way down to the kitchen, cook breakfast, bake and egg pancakes and everything, not burn themselves, put it away, and then go back upstairs and get in bed while they were completely 100% knocked out asleep. So Why would it be such a stretch that people would engage in sexual activity while they are in some sort of REM sleep? It's not that tough to believe, actually. So today, I just wanted to give you something quickly to think about. And on that note, I'm out. You guys have a great day. Stay tuned, and I'll talk to you soon.